Yeast infections are incredibly common. They can affect anyone, but women are more often affected. These infections occur when there is an overgrowth of candida, a type of fungus. Yeast infections primarily affect warm, moist areas like the vagina, mouth, and skin. The good news is that yeast infections are usually treatable. Understanding the causes, symptoms, and treatment options empowers individuals. Yeast infections can be uncomfortable and disruptive. By understanding yeast infections, we can foster better health awareness. Yeast infections arise from an overgrowth of the Candida fungus. This overgrowth can stem from various factors. In women, hormonal changes, like those during pregnancy or menstrual cycle, can disrupt the vaginal flora, making it conducive to Candida growth. Antibiotics, while essential for fighting bacterial infections, can sometimes kill off beneficial bacteria that keep Candida in check, leading to an overgrowth. A weakened immune system can also increase susceptibility to yeast infections. Medical conditions like diabetes, HIV/AIDS, and certain autoimmune disorders can suppress the immune system, making it easier for Candida to thrive. Certain medications like corticosteroids and immunosuppressants can also weaken the immune system. In addition to these factors, certain lifestyle habits can also contribute to yeast infections. Wearing tight synthetic underwear can trap moisture and heat, creating an ideal environment for Candida growth. Similarly, prolonged exposure to wet clothing like swimsuits can also increase the risk. Recognizing the symptoms of a yeast infection is crucial for early detection and timely treatment. The symptoms can vary depending on the location of the infection. Vaginal yeast infections, the most common type, often present with intense itching, burning, and redness around the vaginal area. A thick, white, cottage cheese-like discharge is another telltale sign. Some women may also experience pain or discomfort during urination or sexual intercourse. Oral thrush, a yeast infection in the mouth, manifests as white patches on the tongue, inner cheeks, and sometimes the roof of the mouth. These patches may be painful and bleed slightly when scraped. Skin yeast infections typically appear as red, itchy rashes in warm, moist areas like the groin, armpits, and under the breasts. These rashes may be accompanied by small blisters or pustules. It's important to note that not everyone experiences all of these symptoms. Combating yeast infections. Yeast infections are treatable. Over-the-counter creams, ointments, and suppositories are effective. They contain antifungal agents like clotrimazole or miconazole. For oral thrush, antifungal mouthwashes or tablets are recommended. Natural remedies can also help manage symptoms. Yogurt with live cultures can restore vaginal flora balance. Coconut oil soothes itching and inflammation. Tea tree oil, diluted, can be applied but used with caution. Taking charge of your health. Seeking expert advice. It's crucial to consult a healthcare professional for proper diagnosis and treatment. Self-treating can be risky, as other conditions may mimic the symptoms. A healthcare provider can recommend the most appropriate treatment plan. This is especially important for pregnant women. Seeking professional advice ensures the well-being of both mother and baby. If you experience recurrent infections, consult a doctor to rule out underlying conditions. Early detection and treatment are key to managing yeast infections effectively. This information is an educational aid only. It is not intended as medical advice for individual conditions or treatments. Talk to your doctor, nurse, or pharmacist before following any medical regimen to see if it is safe and effective for you. Want more videos like these? Please like and subscribe.